Thank you, Mr. Chairman, and thank you so much, Dr. Means, for being here, for your family, and congratulations on the birth of your son. If you are confirmed, you know that you will be America's top doctor. And as such, people will be looking to you for scientifically accurate health guidance. So I wanted to drill down a little bit more to understand your views on vaccines and the science supporting Secretary Kennedy's vaccine vision. And I know you said earlier that this really isn't a part of your core message, but I know that you've talked about it before, whether it's on podcasts or on articles or tweets. And so, again, I just wanted to drill down a little bit more on that. And I know previously you stated that hepatitis B vaccine, giving it to a baby born to hepatitis B negative parents is absolute insanity. And I think you did an analogy to it being criminal. I was really pleased to hear you say so strongly here today that vaccines save lives, that you support the vaccinations for children. And so my first question is, if a mother is hepatitis B positive, is providing the vaccine at birth, the most effective way to prevent transmission to the baby. So again, if a mother is hepatitis B positive, is providing the vaccine at birth the most effective way to prevent transmission to the baby?
I believe certainly that is the most effective way. Again, I would just say, obviously the patient should talk to their doctor, but yes, that's a pretty clear case where certainly that would have a huge impact.
Thank you for your response. It appears, even as we're talking about the Secretary's vision for vaccines in this country, that he has basically searched the globe to find things to justify his harmful, unpopular vaccine policies. And just a few weeks ago, we had Dr. Bhattacharya here, the head of NIH, and we got into a dialogue, even with the chairman, about using Denmark as our peer to make these kind of decisions. On December 18th, 2025, the CDC announced funding for a study in Guinea-Bissau, a West African country with just over 2 million people. The CDC-funded study proposed withholding the hepatitis B vaccine birth dose from half of the newborn infants in the trial without screening all mothers for hepatitis B. And as you know, as a doctor, that when babies are exposed to the virus at birth, they can face very high risk of liver damage or cancer later in life. So as a doctor and as a mom, would you agree that it is unethical and dangerous to withhold a life-saving vaccine from babies at risk of a preventable disease?
These are obviously extremely important issues. I am not familiar with the announcement that you just talked about.
But hypothetically, just as a scientist, is it unethical to withhold life-saving vaccine for a baby?
I think that in the case where standard of care is to give a vaccine, and that's the gold standard, I have trouble imagining a scenario where a study would be able to withhold that treatment.
Right, because when
but again, I'm not familiar with the study that you're talking about.
Yeah, and again, study is out there, but when a safe, effective vaccine is available, I think not just as a doctor, but as a human, we want to make sure that
I don't believe that Dr. J. Bhattacharya or the HHS would be interested in withholding.
So we'll make sure you get the study, because what's interesting is that the researchers are also Danish, which is kind of interesting to me.
And also sometimes the devil's in the details, and I think I would want to look into this myself.
But as Surgeon General, it would be your responsibility to act legally and ethically. So you might oversee comprehensive scientific reports and oversee the commissioned core who will conduct research and care for patients throughout the world. Would you advise against a study or refuse to conduct a study with serious ethical implications, even if the secretary or the administration pressured you to?
Certainly as a physician, as a person, as a mother, ethical concerns are of top priority to me, protecting patients, protecting children. I am a strong-willed person who has no problem having direct conversations with anyone, and I would not hesitate to have direct private conversations with anyone about ethical concerns. And also, I do not believe that the secretary or anyone in the administration would ask me to do something unethical.
Well, we'll follow up with you on that particular study. I thank you so much for your indulgence, Mr. Chairman, and this is a vital kind of question for the foundation of this position. So thank you, and I yield back.